Hello, this is Parmar from Dinsa Patel College of Nursing. I am working as a nursing tutor here in Community Health Nursing Department. Today we are going to discuss about Janani Shishu Suraksha Karyakram. It can also be called as JSSK. Janani Shishu Suraksha Karyakram. Institutional deliveries in India increased substantially after launch of Janani Suraksha Yojana. It can also be called as JSY. However, 25% of women still hesitate to access health facilities for delivery due to out-of-pocket expenditure during stay at health facilities on drugs, diet and diagnosis, and arrangement of blood, etc. However, building on the progress of this Safe Motherhood scheme, another major initiative was launched, and it is Janani Shishu Suraksha Karyakram. It can also be called as JSSK. It is launched in 1st June 2011. Its main aim is to eliminate out-of-pocket expenses for both pregnant women and sick infants also. In 2014, the program was extended to all antenatal and postnatal complications during pregnancy, and similar entitlements have been put in place of all sick newborns in infants up to 1 year of age accessing public health institution for the treatment. So we are going to discuss about mission of Janani Shishu Suraksha Karyakram. The scheme is to benefit pregnant women who access government health facilities for their deliveries. Moreover, it will motivate those who still choose to deliver at their homes to option of for institutional deliveries. The people who cannot or who wants not delivery at institutions, so the Janani Shishu Suraksha Karyakram is help them to deliver the baby at home also. Then after objectives of JSSK to eliminate the out-pocket expenses for both pregnant women and neonates. The initiative entitles all pregnant women delivering in the public health institutions to absolutely free and no expenses delivery including cesarean section also. So here are some free entitlements for pregnant women under the Janani Shishu Suraksha Karyakram for safe and healthy motherhood. There is cashless delivery for both normal and cesarean section deliveries. Drugs and diagnostics are also free. Diet for 3 days during normal deliveries and 7 days for cesarean section deliveries. Whenever the mother is required for blood, so blood supplements are also available for her. Then transport from home to health institutions, transport between facilities in case of referral. If mother having any referral to one hospital to another hospital or one unit to another unit, so transportation is also provided by JSSK. Then drop back from institution to home after 48 hours of the delivery. So here is the same entitlement for the mother. So here is the list of free services for pregnant women: free and cashless delivery, free C-section deliveries, then free drugs and consumables, free diagnostics, free diet during stay in the health institution, free provision of blood, exemption from user charges, free transport from home to health institutions, free transport between facilities in case of referral, and free drop back from institutions to home after 48 hours stay in the hospital. Then free services for sick newborns up to 3 days after the birth. Baby has also get some services. So the services include free treatment, free drugs and consumables, free diagnostics, free provision of blood, exemption from user charges, free transport from home to health institutions, free transport between facilities in case of traveler, free drop back from institutions to home. And for newborn care facilities at different levels, there are facilities at different level areas. In primary health center, we can say PHC and sub-centers. So at that, for all newborns at birth, newborn care corner is available like labor room. Then for sick newborns, there is prompt referral unit is also available. At community health centers, for all newborn at birth, there is newborn care corners in labor room and in operation theatre is also available. Then for sick and newborn, there is NBSU, means newborn stabilization unit is also available. Then at district hospital, for all newborns at birth, newborn care corners in labor room and in operation theatre is also available. For sick newborns, there is SNCU, means Special Newborn Care Units. So in JSSK, we ensure the drugs and consumables. It includes an essential drugs list to be notified, ensure regular procurement, uninterrupted supplies and availability of the drugs, ensure quality and shelf life of drugs and supplied. The drug availability of the drugs should be displayed at the health facilities, empower the head of the district to procure drugs to prevent the stock outs. Then strengthen the diagnosis. For that, there is a list. It includes ensure lab and diagnostic services in JSSK, then ensure availability of routine investigations, ensure posting of lab technicians, make emergency investigations available round of the clock, ensure uninterrupted supplies of reagents, consumables required for lab investigations. Empower the head of districts to procure reagents, consumable and other essential to prevent that shortage. Free investigations through PPP and outsourcing also. The next is we ensure the provision of diet in JSSK. It includes ensure provision of diet at all delivery points, at all levels of unit. Then if proper kitchen and adequate manpower is not available, then this service can be outsourced. Local seasonal food, vegetables, fruits, milks and eggs can be given to her for a proper nutritious diet, because these are the multivitamins provided foods, and also it provides supplements to the mother is needed during pregnancy. Then next is medical officer in charge should monitor the quality of food regularly. Diet to be provided 3 days for normal deliveries and 7 days for cesarean section. Fund in advance for ensuring the provision of our free diet. So we ensure availability of blood in case of need for mother and neonates also. It includes prepare time-bound action plan for operationalizing blood banks, maintain adequate stock for each blood group, availability of reagents for blood grouping and blood transfusion, mandatory screening of blood before the storage, adequate funds to blood banks for electric backup. Medical officer in charge of blood bank to periodically visit the bank blood and storage units for monitoring and supervision. Next is the referral transport. It includes transport from home to health facility, referral to the higher center in case of need, drop back from facility to home. Ensure universal reach of the referral transport. State is free to use any suitable model of transportation. Establish call centers with single toll-free model, vehicles with GPS for effective tracking and management. establish linkage for the inaccessible areas. So here are some dissemination of the entitlements. It includes widely publicize these entitlements through print and electronic media. Display them prominently on adequate size hoardings and boards, which is clearly visible for government health facilities. LEC budget sanctioned in the PIP plan under the Reproductive and Child Health Services, and also NRHM means National Rural Health Mission. Next is widely publicize the free and ensured referral transport. Monitor and supervise services at all levels of the center. So thank you.